Hi, I'm Dr. Sherman Silber from the Infertility Center of St. Louis, St. Luke's Hospital here in St. Louis, and we're going to do another Facebook Live. And I have Kendra here with me, who's going to tell us some of her story, and we're going to answer whatever questions that you might have about infertility, about your situation, or in general. And Kendra is one of our many exciting cases of IVF, and she can tell you about it. She was very, very nice in being willing to come on the air with us. So, Kendra, how did we first meet?
Well, thankfully, my dad, Dr. Moore, recommended Dr. Silber, and he was the first person on the list, Dr. Silber, Dr. Pineda, and said, this is where you need to go, because like many people asked, my first child came no questions asked, and then we struggled, couldn't get pregnant, and people didn't think I would have to take the IVF route or the IUI route, and lo and behold, we had a few rounds, and now I have 4 beautiful IVF babies later, and 2 blasts left, and we're working on convincing my husband for number 6.
Wow. So if you can, you'll have 6. And then after you have your 6th, are you going to try for a 7th, or is that too far in the future?
That might be too far in the future, but I think whatever I'm blessed to have, I'm blessed to have, and I will take it. So
it's exciting. You just came from soccer practice.
Yes, soccer practice, juggling babysitters, but all worth it.
Yeah.
Wouldn't trade it for the world.
And so tell us, this is a secondary infertility situation. So what happened? I know you went to Dr. Pineda and got his opinion, but how long had it been that you were trying for another child?
So with my first one, because I was on bed rest for 17 weeks because of preterm labor, we started trying right away, and I felt like something wasn't quite right. And so when I went, trying to think if it had been over 6 months that it did not, we were unsuccessful, obviously, with pregnancy. And so the next route was obviously a specialist. So went to Dr. Pineda. We did try the IUI route, and we were unsuccessful. And then I came to you, and we did, unfortunately, obviously we had 2 failed cycles, and what I told everybody when I went to you is that you kept manipulating the protocol, kept telling me, we're going to get you that baby, and I got my 2 little angels first, and so that was the 3rd round, and they were fresh cycle, which I find everything about it. I should be a pro at this, but I still find it all remarkable, and I learn something new every time I speak with somebody about it or someone else is struggling with it, and it's just incredible because I was really close to giving up, thinking maybe this isn't for me, and I'm, on my 5th child later.
Yeah, isn't that great? Well, I think that's a lot of messages there, really. First place, you almost lost your first one with preterm labor. And then you were ready to, well, you weren't really ready to give up. I know you pretty well. But you were, that thought kept going through your mind, but you weren't going to give up.
No, my husband said we'd go broke trying. So I was ready to keep going.
Well, it's more expensive to raise a kid than to do IVF.
Absolutely. And you know what? I tell everyone, you just, you skip the road trip and go straight to destination. And then I got, my 2 little babies, and it was worth every second. And I know it's hard for a lot of people, and it's definitely an emotional roller coaster at times. And if you have a support system, I think you can get through anything. Obviously, your significant other is your number one, but having my other little one at home, knowing I wanted to get her a sibling, was part of it too. And there were days that were really hard, and there were, the timing was so crucial. But looking back on it, I feel like, okay, we did this, now we can do anything. And that was it.
That's really important. Emotionally, this is so strenuous. I've, in my long career as a physician, I've taken care of many cancer patients, and I've done transplantation, people that were really on the brink of death, and nobody no group of patients seems to be as emotionally distraught and really miserable as infertility patients. To someone who hasn't gone through infertility, they may not understand it. But we see cancer patients, of course, all the time to freeze the ovary or freeze the sperm prior to undergoing sterilizing chemotherapy. So I'm still very familiar with cancer patients. These young cancer patients are not that much afraid that they're going to die. They're pretty sure they're going to survive, be survivors and make it, and most of them do survive and make it. But what really horrifies them is that they can't have kids. So we freeze the ovaries or the eggs to make sure that they can have children. But it's amazing to me that what's of more concern than anything is, it seems intrinsic. They want to have children. So you look very happy and you're bubbly and you've got this incredible outgoing personality.
Oh, thank you.
But you were pretty...
It was very upsetting because when you think, I want to be a mother, you want that immediately. And it is, because there's so much timing. You have to be patient. You have to know that it might not happen. And you just have to hang in there. And like I said, I had family, I had friends. My husband was incredible. And some of my best friends now are actually women I met going through the same thing through here. We'd be at our 5 a.m. ultrasounds. And, and it's not that misery loves company, but just to know that there's someone else out there. I said to my husband, I said, maybe I'm missing my calling. Maybe I need to be a counselor for IVF patients. I said, because I've talked to more people, and I said, if I can help one person that's gone through this, then it's all worth it. I said, despite the fact that we have 4 beautiful children, I said, if I can give back anything and help somebody just maybe one day have a better outlook on it, then it's all worth it. Because you need people. You need to feel that there are other people out there and that it's going to be okay, whatever the outcome may be, whether you get a baby or you don't, but you're not alone. And that's one of the hardest things for women, I think, to understand, because so long it wasn't talked about. And like I said, I'm an open book about it, and I'm willing to share it with anybody. And if I can help anybody, then it's all worthwhile.
You are very, very open about it, but so many people are so shaken by it, and they really don't want to talk about it because it's so deep. And yet it's common. I mean, if you look at population statistics, teenagers in the old days, 3 generations ago, we all got married at age 18, and we might die of old age at 45. I mean, it's a different kind of society we're in now. And but if you look at statistics from way, way back, about 0.2% of teenagers are infertile. 2% of women in their early 20s are infertile. And it goes up to 20% by the time you're 30. And so if you're age 35 and deciding, well, now we'd like to have children, there's a 25% chance that it's not going to happen unless you go through fertility treatment. So there was a very unpopular book written many years back, about 15 years back, advocating that women all try to get pregnant when they're really young because they're going to be less fertile when they're older. And women were very offended by that because they wanted their career and their education, and they didn't want to be told, have your baby when you're 20. But on the other hand, we can freeze eggs now, so people can have babies at a later date if they want. But it's so common that it used to be that you'd have all your babies and you'd be having maybe a vasectomy or a tubal ligation by the time you were 30. You've already had 3 children. But if you start trying to have babies at age 30, often it's really frustrating because you thought you did everything right.
Right, exactly.
So when we see couples that are 40 years old and they say, we've been trying to have a baby for several years and it hasn't worked, all that I can say to them is, well, that's normally what happens. And so there has been a huge growth in infertility treatment all around the world. It's like it's booming. And when I first wrote my first book, How to Get Pregnant, that was in 1979. I remember when I would go on television as part of a book tour, some of the men who were doing the interviewing would just look at me with a funny look on their face and say, how to get pregnant? Doesn't everybody know how to do that? And then they'd have this stupid little smile or laugh. And they had no comprehension. And people didn't talk about it much. And now, 5 editions later, everybody's talking about it. That's if you're 35 and you're not yet married, that's the number one topic of conversation at coffee.
I bet. I believe it.
Yeah. So, anyway, so there's often this issue of do we transfer one embryo or do we transfer 2 embryos? And it's really a hot issue. And what one's supposed to say is transfer 1 embryo. But most women will prefer 2 embryos to be transferred. So what was it like having these twins? Was that tough?
It was incredible. My one little guy says, did I have a party all the time in your belly? And I said, yes, there wasn't much room, but I did 2 embryos every time. And I felt like because it's a lot on a woman's body, and I felt that my chances were better. And if one split, then lo and behold, I'll have identical something. And if the other one takes, then I'll have to find an extra hand of help. But I felt like if I'm going to go through all this, that I wanted to do 2. And I didn't know if I could ever do it again, or especially with me, I think that I did have a hard first pregnancy, that I didn't want to risk losing a baby and maybe not getting pregnant again. I wanted the odds to be that we could possibly have 2. And I knew that was a huge risk, but we were willing to do it. My husband was willing to do it. We knew it would be very hard, and it would be hard on my body, but it was the best decision I could have made. Because like I said, I did have the 2 failed cycles before my first 2, and we did 2 every time. And thankfully we were able to freeze the others and got my other sweet little 2. But I would not change that I did 2 every time for the first 4.
Now, you are pretty skinny looking. I don't want to offend you, but so
I'm running around after a lot of kids.
It doesn't look like you had 5 kids.
Well, thank you. Thank you. It was hard. I couldn't breathe. There wasn't a lot of room. But thanks to Dr. Paul being the best high-risk pregnancy doctor, took good care of me. And it was, I actually did better with my twins than I did with my first. Because,
that's amazing.
Yes, which was incredible. They were like, oh gosh, she's pregnant with twins. And I actually did better. I mean, there were some other complications, obviously, that came up because of having multiples. But overall, I went 36 weeks with the first set, 35 with the second. And there they are.
So you did better.
I did better. So, hey, why not? So triplets might be pushing it, but,
Oh, yeah. Well, of course, you had a really great obstetrician. So
yes, I did. The best. Thank you.
Yeah, he's awesome. So, and we have a number of really good high-risk OBs in this community, so we're really lucky about that.
We do have some questions.
Okay.
Bethany would like to know, what is the process of being able to get IVF, and then what's the average cost?
Okay, so those are big questions, and I'll try to really simplify it if I can. All clinics are kind of different in terms of cost. I think that generally an IVF cycle will normally cost about $10,000 plus drugs. Now, the drugs could cost $1,000, or they could cost $5,000. I personally advocate very, very low dose, very modest drug use. And I think we get better quality embryos that way. And our pregnancy rates are very high, and it's a lot easier on the woman. So I would imagine that $10,000 plus $1,000 or $2,000 should be about what one should expect with IVF. Now, often it'll seem like it's more because there are lots of tests that are performed, and they can add up to huge amounts of money. So I don't advocate a lot of testing because I don't think it helps you get pregnant, and it does add up to the cost. And sometimes it can be surprising. I've seen patients that have come here that have told me that they've already spent $50 or $60 or $70,000 on 2 or 3 cycles that failed. So you've got to really be cautious about that. And so we use now a mini IVF protocol that really reduces the cost a lot and much easier on the patient. You asked about how we start or what we do. Well, that's a huge question. I advocate that first you go on a cycle of birth control pills, because that will, I'm trying to use this in layman's terms, it'll clear you down to baseline. Technical terms, it will rid you of non-ovulated, non-atretic mid-size follicles, non-ovulated follicles. But really, it's like old eggs in the previous cycle or two that we're trying to develop, that didn't develop, and we can clear them out with a cycle of birth control pills. So we start with that. When you stop the pills, you'll start on stimulation. So one method of stimulation is very, very low dose. It's just simple Clomid, and supplement it with a very tiny dose of a shot FSH. And you'll be monitored with ultrasound and hormones every other day. And usually it takes about 10 days until your follicles are ripe and ready. And you can see that by ultrasound and by the hormones. And then the word we use is you're triggered. It's a different hormone that will make the egg mature. Because when the eggs are ready and ripe, they're really not yet able to be fertilized, because the 46 chromosomes have to separate into 23 chromosomes, and that's accomplished by the trigger shot. Or in a natural cycle, when a woman is just cycling normally and getting pregnant normally, first 14 days she'll be developing eggs. The estrogen will go up, and that'll trigger her pituitary to release a huge amount of LH, and that hormone then is going to make the those developing eggs finally mature and reduce their chromosome number from 46 to 23, and they can't be fertilized until then. So, boy, I tried to summarize maybe a whole lifetime of study into as brief an answer as I could.
I think that was good.
You understood all that.
Yes, got it.
Because you went through it enough.
Sarah would like to know, if she's 22 and perfectly healthy, but my husband is older and has a very low sperm count, what would you recommend? They're interested in visiting.
Okay. Well, the issue is that was brought up. She's 22, which is a good young age, and is older. The fact that he's older is not a problem. You may hear that older men are not as fertile, but I've been studying this for 50 years, and there really is no difference in fertility. Sperm count is about 10% lower in men, if you study this, in men in their 80s than men in their 40s. These studies have been a long time ago. And a 10% lower sperm count has no biologic significance at all. So the fact that he's older is not a problem. But the issue is, you say he's got a low sperm count. Well, I don't know from your question whether you want to get pregnant now or want to get pregnant 10 years from now. If you want to get pregnant 10 years from now, I'm not so worried about his sperm as I'm worried about your eggs, because your eggs are going to be getting older as your eggs got older. It's shocking. People will come in, they've already had a baby when they were, say, 27, and now they're 32 and they're trying to have another baby, and it's not working. And they can't believe it, because they were certainly quite fertile before, got pregnant without any trouble, but the pregnancy rate per egg goes down, and the number of eggs goes down very dramatically between your early 20s and when you're 35 and maybe first trying to have a baby. So I don't know your situation, but